My kind of primary project is trying to understand something called minimal residual disease in ovarian cancer, which is basically patients have initial surgery and chemotherapy, and then most patients have no evidence of any residual disease on imaging, like a CAT scan or based on their tumor marker. But we found that if you do a second look laparoscopy, meaning a second surgery, where you look in with a camera and take biopsies, that actually about 50% of patients still do have cancer there. And so our primary interest in this project is actually looking at those biopsies to better understand sort of the biological nature of minimal residual disease so that we can hopefully find better therapeutic targets, and really with the ultimate goal of increasing cure rates for women with advanced stage ovarian cancer where the kind of 5-year survival is less than 50%. So hoping to increase those cure rates by targeting the disease when it's sort of at its lowest volume. The main objective of the grant is to understand why these particular cells that are left behind after initial treatment are so resistant to chemotherapy. And so I think the main impact would be understanding that and then seeing what those cells might be vulnerable to and then selecting certain kind of novel therapeutic options to target that disease phase. So I think the big impact would be on eliminating disease at that standpoint to hopefully give patients a longer disease-free interval. I think understanding ovarian cancer is something that has been very confusing, and not a lot of people really understand why it's so resistant to treatment. And so I think putting in the effort now with all of the new translational technologies that we have to really take a deep dive and working hard now to understand what the kind of main factors in making this disease so chemo-resistant, I think hopefully can help those women directly so that we can eliminate disease at that time point. I think many of us, especially fellows in training or junior faculty, it can be hard to get enough money to do the research that we want to do, especially some of these newer translational studies are amazing and really do a deep dive in understanding the biology, but are very expensive. And so I think having the funding to be able to do that at an early level can then propel your career in a way where you can get larger grants and really take a deeper dive on this. And so these are really instrumental early career grants that I know I'm very grateful for, and I know many people who have received the grant are very grateful for. And so just supporting that mission of early career investigators, really helping them get their feet under them and really develop a research niche in the field. Recently, I saw a patient who was in her 40s, who was newly diagnosed with ovarian cancer, underwent surgery, chemotherapy, and her CT scan showed no evidence of disease, and she didn't get any additional therapy, and then a year later she relapsed. She has 3 young kids, and her prognosis is now not good. And so being able to detect that earlier, that this patient might be at higher risk for recurrence because they still have this minimal residual disease, I think could really make an impact on a patient like that, being able to target it early and hopefully really extend the meaningful years that patient and many other patients may have with their loved ones.